The AutoBand ligator is used for endoscopic ligation of esophageal varices at and above the esophageal junction, as well as internal hemorrhoids in the colon. The AutoBand ligator is supplied non-sterile and is intended for single use only. As you watch the instructions for the AutoBand ligator's assembly and band deployment, keep in mind that two things are essential to the successful operation of this device. The first of these is to make sure that the trigger wire is pulled taut, leaving no slack before closing the locking tab. The second is the technique for deploying the bands. It is important to turn the wheel in one smooth, continuous motion until you feel a firm stop, then release, allowing the wheel to return to its original position. Open the package and remove the 4 protective tubing sleeves located in each corner of the tray. Remove the handle, trigger wire, and band barrel. Remove the rubber biopsy valve from the endoscope and advance the trigger wire through the valve. Advance the valve up the trigger wire until it is seated completely on the plastic stem of the handle. Insert and advance the trigger wire completely through the biopsy channel. Ensure that the looped end of the trigger wire extends approximately 5 centimeters from the distal end of the endoscope. Attach the biopsy valve and handle to the biopsy port on the endoscope. Ensure that the plastic stem of the handle seats well within the valve. Wrap the Velcro strap around the endoscope. Ensure that the strap has been pulled taut and secures the device to the endoscope. Snap the stability arm onto the endoscope. The handle should rest securely on the endoscope. Please note, some scopes, such as Pentax, have a larger scope body at the biopsy port and require the universal tape ligator. Use the additional Velcro strap to secure the stability arm onto the endoscope. Pass the barrel thread of the band barrel through the loop of the trigger wire. Create a slip knot by advancing the band barrel through the barrel thread loop and pull tight. Open the wire locking tab and pull the wire until the band barrel contacts the distal end of the endoscope. Align the red stripe on the band barrel with the biopsy channel. Advance the soft portion of the band barrel onto the endoscope. Continue advancing until the plastic portion of the band barrel contacts the distal end of the endoscope. The scope should occupy approximately 1/2 of the barrel. Remove the red tearaway strip and peel away the protective plastic sleeve on the band barrel. While watching the video monitor or confirming manually, gently and slowly pull the wire at the locking tab until the nylon cord of the barrel is straight and all slack removed. To correct any interference with your field of view caused by the barrel thread, you may rotate the band barrel. Firmly close the wire locking tab. The AutoBand is now ready to use. To deploy the ligating band, rotate the wheel on the handle clockwise in one continuous motion. Important: rotate the wheel continuously and completely in one motion to ensure proper band deployment. Do not stop rotating until solid resistance is met. Release the wheel upon completion of rotation. The wheel will automatically return to the start position when released. Note: the irrigation tube on the handle is available to provide irrigation of the biopsy channel if needed. Attach a lure lock connector to the syringe filled with sterile water and irrigate. We hope that this demonstration of assembly and band deployment has been helpful. And remember, two important keys to successful use of the AutoBand ligator are making sure that the trigger wire is pulled taut before closing the locking tab, and when deploying the bands, turn the wheel in one smooth, continuous motion until a firm stop is felt as shown in the video. To learn more about AutoBand, please contact EndoChoice Customer Care at 888-682-3636.